I really value my time here at SBMT because of the fact that it's a multidisciplinary group of people working together to advance spinal pathology research and also to do research in brain injury and traumatic brain injury. We have a whole host of different types of talks and programs during our SBMT Congress every year where we kind of work on bringing together ideas from disparate specialties to get people on the same page regarding specific disease factors.
So, and this association is not just a show, a convention, but rather a think tank.
There are basically miracles being created every day by the folks here.
There are some answers you will never find in a textbook, and that's called experience. I bring that with several of my colleagues, and we have learned some things along the way that we want to share because we don't want you to make the same mistake that we made.
It's one of the gems of our program here at the annual Congress, our Bioskills Lab.
I came here to see just surgery, blood, and mapping of the brain, but afterwards we see that is more than that. Here you have a connections with many other colleagues from other fields of interest, so it's a great pleasure for us. To come here overseas to see a cadaver lab is important because if you're going to pay different costs like this, it's lots of money. So here you have a great experience with the cadaver and high quality, with high-end tools, and it's a great pleasure for neurosurgeons to be involved in these bioskill labs.
Where you can learn about spinal surgery, brain surgery. It's an unbelievable experience. This year we have new optometrists who've been coming, and they're amazed at the collaboration. So in my session, we used up our break time talking because the speakers were so fascinating. And you have we had the other day a neuro-ophthalmologist, we had an imaging specialist.
We have surgeons from Italy, surgeons from Brazil, locally from Portland, Oregon, here in LA.
World-class neurosurgeons that were involved in very complex approaches, and they described the anatomy and their approach to these means of accessing the central nervous system using different routes. And it was great for trainees, for residents, medical students, and even fully trained neurosurgeons that are willing to learn a new approach.
Talented surgeons that are coming to the field that are really showcasing their ability to demonstrate what we have learned during surgery. You are coming to a place where you not only can learn these skills, but you can have direct one-on-one contact with experts in the field, right there in front of you.
We're very unique in that we're the leaders in motion preservation of the spine as an option to fusion for degenerative disc disease of the cervical and lumbar region. So with that, we're the only company in the United States that has a cervical disc and a lumbar disc to restore back motion in those segments of the spine. We decided to participate and help with the meeting because there was a session on cervical disc arthroplasty, and we felt that it was important to partake in that so that other surgeons can learn about our innovative technologies for disc arthroplasty.
It was very nice because very good microscope and very good monitors, and the participants can watch very good, and I can explain my technique more detailed and more useful explanation.
Yeah, the importance of educating the attendees on our technologies is that they can learn now that there's another option for patients for fusion. So most patients that have presented with degenerative disc disease and pathologies around that have only had the option of fusion. And the newer technology now is, now can we look at restoring back motion in those segments of the spine.
SBMT has been recognized for their Bioskills labs. Very innovative.
That's dedicated to cerebrovascular skull-based neurosurgery. We have a section dedicated to spine surgery. We have a section dedicated to bypass surgery. And the hope is that when it comes to the human brain, there are so many things you need to learn, especially if you want to be a neurosurgeon over 7 years.
Out of our work group and out of our cadaver labs, we've innovated and also honed different types of surgical approaches and therapies for the spine that are minimally invasive, that provide the surgical solution in terms of either addressing the pathology, but also with a less invasive surgical corridor where it's minimally invasive, there's less tissue disruption, less blood loss, less hospital stay, fewer complications, lower risk of CSF leak. And out of this, we've developed different products, different innovations, different approaches, and it's been a whole kind of a brainstorming session during these cadaver labs regarding how we can do surgery better.
There are different disciplines to a particular approach to a problem, in this case brain cancer, which is a huge unmet need in medicine. And so it brings together engineers, neurosurgeons, pathologists, radiation oncologists to look at various ways of approaching a very difficult problem.
And I think it's technology that, in my personal experience of doing it, and being a large proponent and with 20 plus years experience, is that I think it's kind of like having a hip replacement, is that it could be the most gratifying operation for the patient and the outcome, as a hip surgery is. I mean, of all surgical procedures, it's the #1 in satisfaction for the patient. And the same thing could be true, I think, for artificial disc technology, is that it could be a real game changer, and it is, at least in my view, in the small number of people who really have a lot of experience doing it. The patients are the ones who benefit. That's what it's all about.
We get an amazing number of attendees. It's really, really the cornerstone of training the future doctors and leaders of America and neuroscientists.
I am part of the organization team of the subcommittee of the vascular and the cervical spine and spine section. In that way, I can mix all the knowledge that I have and improve the quality of those who are here to attend.
Our goal is that we want you to come to this meeting and come to the Bioskills lab to really touch the instruments and things that are going to not only make you a better surgeon, but help you explore the possibilities of this is what we have today. Where are we going tomorrow?